lot of people wonder if there's a cure for Alzheimer's disease or dementia, and how is it treated. So there are no medications that will cure Alzheimer's disease, or vascular dementia, or any of the irreversible dementias. There's no medication that will actually cure it. There are a couple of medications that may slow down the progression. Really not a whole lot of proof of whether it works or not. Some doctors will prescribe it, and it seems that those people, they go through the dementia a little bit slower than people who are not on it. But since they're different people, we don't know if that would have been the same. The two most common ones are Aricept and Namenda. Those will be the ones that you hear most often. Research has shown that the best thing to do is a behavioral intervention. How do you help to keep them from getting agitated? What can you do to make their environment as normal as possible? So it's really life management, support, encouraging them to be as independent as possible, a person-centered treatment. What's the best for them? Not everybody's going to want the same thing. So we have to do what works best for that person. Being patient as a caregiver, making sure that we have a lot of patience and figure out what it is that we need. Understand what's happening to them, adapt their environment, rather than trying to get them to adapt to ours. A lot of people will move their parent into their home with them when they have dementia because they feel that they need supervision. And I think that that's probably a good thing. Problem is that's not their familiar environment, so it's going to cause a lot more agitation. It's going to take them some time to get used to it. If you can move into the home where the person lives, which is familiar to them, that certainly is better. Doesn't always work well for the caregiver, but it's better because it's their environment. We need to live in their reality. You know, there have been several situations where someone will be looking for their spouse, but the spouse has died. And so the question is, do you tell them that the spouse has died? Maybe they died 10 years ago. The reality is they're not going to remember it anyway, right? So they have forgotten it now. Short-term memory loss, they're not going to remember it. But if you tell them now, oh no, your husband's dead, since they didn't remember it, they're going to grieve all over again, right? So do we want to put them through that emotional grief by telling them that their spouse has passed away? It's not really the best option because they're going to ask you again in a half an hour, and then you're going to have to go through it all over again. So what do you do? How do you handle that if they say, you know, where's Bob? Why isn't Bob home? Instead of saying that he's passed away, oh, he's on a business trip, right? So this is where you need to know the history. Maybe he played golf. Oh, Bob's playing golf. Or he's on a business trip. Or he went to visit his friends, right? So an answer that they will know, they will understand, and they'll believe, right? Something that was in the past. And then you try and you get them involved in something else. The other thing you can do is reminisce about Bob. Oh, well, how long did you guys know each other? When did you get married? Tell me about your wedding, right? And so then they have the option to talk about this person. So that's another thing to do. So reminiscing is great. Another way to help treat dementia is to make sure that the people around you know what's going on. So a lot of times people will isolate if they're taking care of someone with dementia. They won't go out to dinner because they're afraid they'll be embarrassed. They don't go to the movies. They don't go and do things. So educating your friends, educating people around you. I had a client once who made up little cards that said, my husband has dementia, he may behave inappropriately, please be patient with us. And they'd go to a restaurant and hand it to the waitress. They'd go you know, to a museum, or they'd do something and they'd hand it to the people around them so that they wouldn't have to feel embarrassed and they wouldn't have to explain it, right? They'd hand that out. So that's a good way to do it. So the best thing really is just to understand what's happening and let everybody else around you know, and then again adapt your approach to what their needs are.